Is there, I mean, I know that probably a lot of women want to know this, but is there a magical age at which point it becomes Coming up on Face the State, nearly 1 in 5 known pregnancies ends in miscarriage, but many don't realize how common they are and what really causes them. We'll speak to a fertility specialist about miscarriage and fertility myths. Then, for years, the U.S. military has been giving surplus equipment to local law enforcement, everything from clothing to tanks. But now the program is getting stricter regulation. Hear from the Washoe County Sheriff about how that affects us when Face the State starts right after the break. Welcome to Face the State. I'm Ariana Bennett. Thank you for joining us. Well, when it comes to getting pregnant, fertility is something many couples take for granted. But in the United States, the average age of pregnancy has gone way up in the last 15 years, making it more difficult for some couples to conceive. Now, Dr. Scott Whitten from the Nevada Center for Reproductive Medicine is here now to talk about that. Scott, thank you so much for coming on the show.
Thank you for having me.
Okay, so in your practice, have you seen an increase of couples coming in needing a little help?
We have seen an influx of patients. We feel it's most likely due to the economy changing and improving. Women are getting older and they come seek fertility services as they get older and establish their careers. The average age of our patients in our office is probably in the mid-30s to low 40s.
Is there, I mean, I know that probably a lot of women want to know this, but is there a magical age at which point it becomes more difficult?
Well, typically we look at the age of about 35 as a cutoff point, because if you're less than 35 years old, then we essentially like you to try for about a year if you have regular periods. And if you haven't achieved a pregnancy in that year, then we would say you have infertility and we should do some testing. But women who are over 35, it's different. We don't have quite as much time, so we have them try for about 6 months. If they haven't achieved pregnancy in 6 months, then we ask them to come in and do some testing.
So in that testing, what are the most common things that you find?
Yeah, a lot of times it's due to hormones or ovulation disorders. That's the process of hormones causing the release of the egg from the ovary. That's one of the most common things. But whenever you're looking at infertility in couples, you have to realize that it takes two. And so we always do testing on the women and the men to make sure that we don't miss anything.
And there are a lot of things that can affect fertility, right? I mean, it's not just age, it's also weight is something that I thought was interesting.
Weight's very important. A lot of times women, if they carry extra weight, it can affect the way that the hormone comes from the brain to the ovaries and causes a change in the way that they cycle, which can then result in abnormal menstrual cycles and then difficulty getting pregnant. But other things like lifestyle too, smoking, excessive caffeine intake, and even women who exercise excessively can have a shut off of their periods completely, which can obviously then result in infertility too.
Now, excessive caffeine, what counts as excessive?
Well, for me and you, it's a little bit different, but for a woman who's trying to get pregnant, probably about 1 caffeinated beverage per day is okay until pregnancy is achieved. And then after that, the recommendation is no caffeinated beverages, because there is an increased risk of miscarriage.
Oh, okay. Wow. So that probably, I'd say most people are probably over that amount of caffeine. 1 per day, that's, couldn't you have 2 cups of coffee?
That's true.
So is it a tough thing? I mean, when people come to you, do they have to make a lot of lifestyle changes typically?
We do look at their lifestyle and make recommendations. Lifestyle is very difficult to change for most patients, but certainly we encourage them to achieve their most ideal body weight that they can, avoid smoky environments, alcohol in excess, of course, and then just taking their prenatal vitamins is important too.
What's the timeline? What's the average amount of time that it takes a couple to conceive if they're trying?
It depends upon the age. And the age of the woman really is the biggest determinant of how successful they're going to be. For example, if you're a woman in your early 20s, chance of conception in 1 month is about 25%. If you're a woman who's 40 years old, it's about 10% per month. So depending upon that success rate will determine how long it might take you to actually achieve that pregnancy.
And that's without any help?
That's without help. That's just natural conception.
Wow, interesting.
That's right.
Okay, now you mentioned earlier risk factors for miscarriages. That's kind of a topic I really wanted to get to. In my research for this, I found out that miscarriages are a lot more common than I think is common knowledge. 1 in 5 women, or 1 in 5 pregnancies, rather. Let's talk about that a little bit.
Yeah, miscarriages are a lot more common than women think they are, and especially if they have one and they share that with their friends, they do find out that a lot of their friends have experienced miscarriages too. And that also is age dependent. A woman who's in her early 20s, the chance of miscarriage is around 10-15%. But when you're about 42, the chance of miscarriage is around 45%. And that's usually due to abnormalities made within the egg when it's formed, which is usually a chromosomal abnormality that translates into a problem with the abnormal pregnancy and then a miscarriage.
Right, and that's kind of the key thing there, that the majority of miscarriages aren't due to anything the mother did. It was just an abnormality in the fetus, correct?
That's right. So a lot of women blame themselves when they've had a miscarriage, that they did something wrong, that it's their job that they did or the exercise they did or something like that. And the majority of the time that is not the case. Most of the time they didn't do anything that actually caused the miscarriage. It just wasn't a normal pregnancy from the beginning, and its end result was to be a miscarriage.
Yeah, and there's a lot of guilt that I think a lot of women carry about this, largely because it's not discussed. Why do you think that it isn't as more common knowledge?
I think it's a very private topic for women. I think that when a woman has a miscarriage, sometimes she's ashamed, or maybe she feels like she's an inadequate woman if she can't bear a child, and she has fears that the next time she becomes pregnant, she might have another miscarriage, and maybe her dreams of being a mother won't ever come to fruition. So I think there's a lot built into that, what they experience emotionally from a miscarriage. Even when it's very early or if it's late, they still go through the same process.
So women who have one, are they at greater risk for having more miscarriages?
They are, and that also depends upon if they've had a normal pregnancy before that or not. If they've had a normal pregnancy before, then if they have a miscarriage, they're most likely going to do fine in the next one.
So for women who have one, I mean, is it a well-based fear that, oh, well, I've had one and now it's going to be hard for me to carry a child to term forever?
What I try to do is reassure them if they've experienced one miscarriage that most likely there's nothing wrong. You're just waiting for the right pregnancy and the healthy pregnancy. But in some cases, women will have recurrent miscarriages. And if you have 2 or 3 in a row, then we start to do some testing to try to investigate certain causes that may be contributing to the losses.
Is there anything you can do about that?
There's actually quite a bit we can do. It kind of depends upon what we find, but it spans anywhere from looking at structural problems with the uterus that might be treated surgically and restore their ability to carry, or it might be genetic or chromosomal abnormalities that we actually can address as well.
Wow, I didn't realize there were so many different avenues.
That's right. Several different causes of miscarriages too. You can have immune causes, you can have hormone abnormalities, and you can have growths or structural abnormalities of the uterus too. So it just depends upon what we find.
Is there anything that that's controllable? I mean, a lot of these factors are things that you can't control or may not even know about, but I mean, what would you tell people who have maybe experienced one and are trying to minimize the chances of having another?
The best thing that you can do is just try to maintain good lifestyle. So well-balanced diet, prenatal vitamins, avoid toxins and exposures, and just take care of yourself.
Now, I guess what advice would you give for couples who are really concerned about all of this stuff? Do you have any one magical piece of advice?
Well, I don't know if it's magical or not, but certainly the advice I would give them is make sure that they are tracking their cycles, make sure that she's ovulating correctly, timing the intercourse appropriately if they're trying for pregnancy, because you really want to shorten the time to conception, because the longer it goes on before conceiving, the more anxiety that builds up. And so if you can shorten it, then monitoring those cycles and just timing things the best is all you can really do.
Can the anxiety itself make it harder to conceive?
It can. Some patients really carry a lot of stress with them, and stress can affect the hormones, like cortisol can then have effect on some of the reproductive hormones. And we do feel that that can actually contribute towards infertility and miscarriages. It's really hard to quantify for patients, like how stressed somebody is, and then also how do you treat it? Because all of us handle stress differently. Some of us go and exercise, some of us meditate, and so it's really hard to address stress, but we certainly believe it's a true element.
So what are the most effective methods that you guys employ to treat infertility?
So a lot of times we just correct whatever we find to be wrong. So say a guy has a low sperm count and that's all we can find. We might place sperm up in the uterus closer to the egg, shorten that distance it has to go. Sometimes it might be due to ovulation disorders, and so we'll give hormones to help a woman ovulate, ensure that's happening. Usually they get pregnant pretty easily. But if they have a problem with like the fallopian tubes, say the fallopian tubes are blocked for whatever reason, then the treatment of choice at that point is in vitro fertilization, IVF, where you don't use fallopian tubes.
Okay. How common is this? I mean, is it a lot of people who experience infertility problems?
It's about 15% of the reproductive population experience infertility. And those are the ones that come see us. We do full evaluations on them, and we end up treating the majority of them, and unfortunately the majority of them are successful in getting pregnant too.
Yeah, great news. Okay,
Yeah.
well, is there anything else you wanted to add? Anything I didn't ask about?
Well, I think one thing that's important patients should know is that if they do have problems with embryos that are chromosomally abnormal and they're having miscarriages from that, there are ways for us to test embryos prior to them getting pregnant, so they don't have to go through that. And that is the latest technology that's out there. It's called pre-implantation genetic screening.
Wow.
So I can tell you what your embryo is chromosomally before I would place it into your uterus for pregnancy. So because the most common reason for miscarriage is chromosomal abnormalities, if I can account for that and address it, then you're most likely going to have a good outcome.
Is that really expensive?
It can be. Unfortunately, with new technology, it's always expensive at first, but it is coming down.
And any of it covered by insurance?
Some patients it is, actually, yeah.
Okay.
Not as many as we'd like, though.
Yeah, interesting stuff. Okay,
Yeah.
Dr. Witten, thank
Great.
you so much for your time. I
Thank
sure
you.
appreciated it.
Thank you.
Well, coming up on Face the State, a federal program that repurposes military supplies to local police departments is seeing stricter regulations. We'll speak with the Washoe County Sheriff about how this will affect us locally right after the break. Welcome back to Face the State. I'm Ariana Bennett. Thank you for joining us. Well, President Obama recently announced that he's making an executive order to change the military surplus 1033 program. Now, the program takes extra military equipment and gives it to local law enforcement agencies, including some of ours here in northern Nevada. Now, the program has come under fire, though, for equipping local police with things like military-grade weapons and armored vehicles, making some residents say they feel unsafe in their communities. Now, Washoe County Sheriff Chuck Allen is here with us to talk about the program and the relationship between law enforcement and citizens here. Sheriff, thank you so much for coming on the show.
Thank you, Ariana.
Now, we're in your first term as sheriff. How's it been going so far?
It's been very busy, challenging but fun, yet very busy.
Is it a huge difference, being sheriff versus working for the Highway Patrol?
Oh yeah, absolutely. It's great to be in that leadership position. I've got a great team of folks. Actually, I'm learning every day more about the people, the personalities, and how talented and lucky Northern Nevada is to have 750 employees of the Washoe County Sheriff's Office, and how committed they are to making a difference.
Yeah, it's a really big department.
It is. It sure is.
What's been the biggest challenge so far?
Well, I mean, right off the cuff, I would say trying to learn people's names internally. But stepping into office, prepping for the budget, which was just approved, and then finishing up with the legislative session are two of the big things that we want to get through. And then I've got several things that I want to unveil and get started this year as well.
Yeah, I know, whether you're talking about the NHP or you're talking about the Sheriff's Office, I think this applies to all law enforcement in general. How would you characterize the relationship between our law enforcement and our community? I know there's been some tensions in other parts of the country. Are you seeing that at all here?
Yeah, and I think anybody who reads the paper or watches TV or listens to the radio can pick out different situations across the country that have alarmed us, if you will. But I feel very blessed, very fortunate to have the working relationships not only with the city, local, state, county, and federal partners, but I think all of us here in Northern Nevada are a special community, and that we are involved with our citizens and that we connect with them in a much better way. And I think, in my opinion, that has been one of the downfalls in other situations that we could cite.
Are there concerns that situations like we saw in Ferguson or like we've seen in other cities could happen here?
Well, I think a situation like that could happen anywhere, but I really truly believe as a leader, whether you're a police officer on the street, a deputy sheriff on the street, a state trooper out there on the highways, each and every day we need to build trust and earn the respect of the community in everything we do. And I think fairness and equality should be considered whenever we're dealing with anyone in our lives, from our home life to our professional life. As long as you treat every single person you come in contact with dignity, with respect, with fairness and equality, you would minimize a lot of the situations, in my opinion, that we've seen throughout the country.
Is the department doing anything differently in this kind of new situation that we're seeing nationally to make sure that it doesn't go to a tense place?
Well, I mean, there are a number of things that are taught in the academy, obviously on how to deal with people, how to interact with people, how to stay safe, because we do have a job to do, and often it's the person that we're dealing with, the victim, not so much the victim, but let's say a suspect in a crime, for example, that kind of dictates our reaction on how those situations are handled. For example, you have a deputy that needs to place somebody under arrest, goes to place the handcuffs on, and then the person turns around and takes a swing at the deputy. Well, now the level of force has to be elevated where you can subdue that subject, for example. So, but again, a lot of it can be handled in how you communicate with people.
Right. It's a tough situation. I think most people can acknowledge that law enforcement is in, your lives are in danger as well when you do your jobs. And
right.
So it's a tough line to walk sometimes.
Right. And we have, I have great working relationships with the 2 police chiefs locally, with our federal partners, and we're continuing to build our relationships with our spiritual leaders in the community, with other elected officials in the community. For example, the law enforcement community, all the leaders meet monthly for breakfast. So we network, we have dialogue about what is going on in our community, what issues they're facing, et cetera. And I think just having that great working relationship, so if and when we have a big event, we're able to respond in a professional manner and be able to mitigate those circumstances.
Okay. Now, kind of getting to the topic of the day, these changes to the 1033 program, I think kind of as a response to some of the tensions we've seen in other cities, these pictures that you see coming out of the clashes between law enforcement and citizens, you see law enforcement decked out like military, and a lot of that is because they had military supplies through this 1033 program.
Right.
The Sheriff's Office does receive supplies through this program. Just tell me about the Sheriff's Office involvement with that.
Yeah, I mean, probably one of the biggest assets that we have acquired from the DERMO program, the 1033 program, is our aerial assets, our aviation units, the Raven helicopter. In fact, we just recently acquired one, primarily going to be used for parts, but for every time those assets are put out on the website, it's a very, very competitive effort to grab those. But most of the things that we have in our inventory as it relates to that particular program are just day-to-day items, anything from sleeping bags to binoculars to first aid kits to other items that wouldn't really fall into the category of military-related items that the general public. And I have to add one more thing. Our SWAT team, their uniform traditionally was sort of a military blend. It almost looks like an Army camouflage BDU type uniform. Those are all transitioning to more of a solid lighter green color to give it less of a military appearance.
Okay, yeah, I mean, I saw the itemized list, about $800,000 worth of stuff over the last 2 years, but if you look at it, it really is mostly clothing, more mundane items than the grenade launchers and automatic weapons that you see more publicized. Can you see a reason for a local law enforcement body getting those types of things from this program,
I
like
mean,
armored cars, grenade launchers?
I don't really see the value in it. I mean, I think when you attach the word free to anything and you're an agency or department that has a very fixed budget, it may seem like a very easy asset to acquire. For example, an armored personnel carrier. I mean, if your city doesn't have the budget to go out and buy a SWAT truck, for example, has a city council, has a governing board, that might be an easy fix for you. But again, the public's perception is always going to be your military is our department. So.
Yeah, so you can't necessarily, or can you think of a scenario in which it would be appropriate for a local law enforcement body to have that kind of thing?
You know, I can't. I mean, it's a great program. Some of the things that we get to acquire throughout the year are very, very beneficial and does reduce items that we would normally have to pay for out of our budget. But when you talk about, you know, tanks and armored personnel carriers and grenade launchers, et cetera, I don't see a place for that in the law enforcement business.
Okay. Now, kind of on the other side of this, one of the issues is having kind of an inherent trust in law enforcement, and one of the solutions that's been tossed around is body cameras for officers.
Absolutely.
Is that something that you'd be in favor of?
Yes, I mean, we're having those discussions now on a regular basis. It's one of the several bills being introduced this year as it relates to law enforcement officers around the state of Nevada. You know, the big concern is not so much the cost to buy the camera itself, but it's to store all that digital data and just managing that program. And then that's just one piece of it. The other piece is, how are you going to protect victim rights when a media source wants footage from a particular officer's encounter with a citizen? So there are many, many moving pieces to that bill or to that project, and I think we need to proceed with that very carefully.
Yeah, I mean, there are a lot of implications where body cameras are concerned, even just things like victims maybe not wanting to be on camera at a time when they can't control it, or if you are going into someone's home.
Correct.
At what point do you turn the cameras off, and can you turn the cameras off? Because if you can, then does it undermine the whole point?
But it does change behavior, though. I will say that, you know, dash cams on the patrol vehicles will change, an offender's behavior. It definitely changes an officer's behavior. I know that because, you know you're being taped. You know you're being videotaped, and so you tend to control what you say. And I think citizens are the same way. Once they are told that they are being filmed or recorded, you know, they change their language, they change their demeanor.
So you think in general this is the direction that most law enforcement agencies are going to go, body cameras?
I think it's going to evolve in that regard. I mean, but I think there just needs to be a fiscal note attached to it. So, you know, each individual county isn't struggling on how are they going to pay for that big endeavor.
Right, because I mean, how many deputies do you have?
422 who wear uniforms. So if we were to put a camera on every single one, including those who serve in the jail and in detention, I should say, it's a very expensive project. Very, very expensive.
And then the data storage, which...
Right, and then you have to have at least several personnel to categorize it, to label it, and to store it, not counting all the technical equipment to do that.
Any idea how long a project like that could take?
I don't. I mean, I think we would model it off another department, such as the Las Vegas Metropolitan Police Department is currently studying cameras in their agency. So I see it as a wave of the future, but with a cost to it.
Okay. Now, as sheriff, is there any one project now that you're really looking at? This is my thing that I want to get through right now.
Well, I talked about the budget. I talked about the budget cycle and the legislative cycle, I should say. But I'm really going to focus on growing the department, bringing on more reserve deputies, and then jump-starting and getting my green ribbon panel started by August 1st. That's the target date I set for that. And that basically, Ariana, is a panel of individuals from the community comprised of spiritual leaders, community leaders, elected officials, and others from the community who want to serve on this panel and be engaged with the sheriff's office. And it's a networking opportunity for the community to get involved in, basically.
Okay. How's the reserve deputy program going?
Going well. We've finished several waves of the physical fitness testing piece. So we have several dozen applicants in what we call the background investigation piece. So I was looking at a target start date of around July, but we are actually hiring other folks too for the agency. So I don't want to overwhelm the background investigation unit with the reserve deputy applicants. So we may have to delay that academy until late this summer or first thing early in the fall.
An idea how many people will be in the first group?
My target number is 20.
Okay.
My target number is 20.
And you think you'll have that many takers, people who
Right.
wanna
I
do
mean,
it?
we're down to, like I said, several dozen who just recently completed the physical fitness testing.
Mm-hmm.
These are members of the community, 7 MDs, medical doctors who have
Wow.
applied. So a very diverse group of individuals who are willing to serve. So looking forward to the outcome of who's in the first academy.
Okay, we have about a minute left. Is there any message you wanna give to your constituents?
You know, it's just, it's an exciting time for many of us in Northern Nevada. You have a lot of new leadership in Washoe County and the city of Reno. You know, we just want people to stay safe. And if you see something in your neighborhood, no matter where that neighborhood is, it doesn't seem right, definitely report it. I would rather have somebody report something suspicious than to let that go. And just get involved in your community.
Yeah, and we're growing too. I mean,
Right, I would say get involved in your community.
things are probably going to be changing a little bit in your job as well as our county grows
Right,
and we get
absolutely.
more population coming in. And all right, Sheriff Chuck, thank you so much for coming on the
Thank
show.
you,
I do
Ariana.
appreciate your time. That is it for this episode of Face the State. But for more information or to see our past episodes, just head to our website, ktvn.com. Thank you for joining us. We will see you next week.
I'm Erin Breen. You know, Story County is really taking aim at manufacturing these days. And it's really paying off. We're going to have that story for you at 5:30.